are going to deal on the most important topic, so that is diabetic ketoacidosis. Here, the three words are there: diabetic, ketoacidosis. Here, the what happens, what it means, and so how we're going to prevent the diabetic ketoacidosis is very important. Here, the diabetic is nothing but the persons who are suffering from a diabetes mellitus. It means hyperglycemia or increased blood sugar level in the body. Here, the ketones nothing but when so there is a lack of insulin, our body cells uses, so instead of glucose uses as a, so that is fat as a, so the energy for the body cells. End product of fat is nothing but, so it is ketones. The acidosis is nothing but the ketones adverse effect upon the blood. It causes, so that is blood pH becomes false. Okay, so that condition would be called as, so that acidosis. Okay, the combining, so three words will be called as diabetic ketoacidosis. It means so the alteration of blood pH, it may takes place resulting from a, so the ketone bodies as a complications of diabetic mellitus. Now come to normal pH, what happens? Normal human blood pH. So 7.35 to 7.4 point. Okay, in case of diabetic, so that is ketoacidosis, the blood pH becomes falls down below the 7.35. Now it is a, now come to the definitions. So what is exactly so the diabetic ketoacidosis? The diabetic ketoacidosis is defined as it is a life-threatening medical emergency conditions, so resulting from insulin deficiency, so characterized by the, so there is Kussmaul's respirations, ketone breath, so the ketonuria, polyuria, polyphagia, and the polydyspia. It is called as, so the diabetic ketoacidosis. What happens in case of diabetic ketoacidosis? So normally, so the body uses the glucose as energy due to the insulin deficiency or lack of insulin or a resistance developed by the body cells toward the insulin. So the body cells uses a fat as a energy. The end products of a fat is called as ketone bodies, that is ketone productions. Okay, it may cause, that is alteration in the blood pH, so that condition we call as acidosis. Now come to the, what are the causes for, so that is diabetic ketoacidosis. Here the type 1 diabetes mellitus is most common for, so that is diabetic ketoacidosis, but the type 2 diabetes also it may cause the diabetic ketoacidosis. Here it is the most important, so the first complications of a, so diabetes mellitus untreated, okay, so undiagnosed diabetes mellitus. Here the type 1 diabetes mellitus is very common, so the missing doses of insulin, the persons who are taking, so that is diabetic treatment, okay, so that is skip, so that is medical treatment means, or they are not taking a regular, okay, so that is daily insulin. It is also a contributing factor or contributing cause for the developing a diabetic ketoacidosis. Then some of the infections like a pneumonia and the UTI also the contribute, okay, so may cause diabetic ketoacidosis. Then the most important thing is undiagnosed diabetes mellitus. Okay, almost all people they're not doing a regular checkup. They are having a, so that is so diabetic mellitus. They will go after the complication only. Okay, it is also the most important cause for developing a, so the diabetic ketoacidosis. Now come to the, so what are the signs and symptoms we are going to see in case of, so the diabetic ketoacidosis? Yeah, the first one is Kussmaul's respiration. It means so rapid, very short, so the air hunger. So that type of breathing would be called as Kussmaul's respirations. Ketone breath. It means so that is fruity breath or a sweet breath while breathing. So that is the breath or smell will be very sweety. Okay, then so the ketonuria. So ketonuria it means the presence of ketone bodies in a urine is called as a ketonuria. And polyuria, excessive urination, the polyphagia, so it is excessive thirst and excessive taking and polyphagia, polyuria, polyphagia, and polydysphagia. Okay, so these are the signs and symptoms we are going to see in the persons who are suffering from, so that is diabetic ketoacidosis. Okay, so along these signs, also the severe headache, so there is confusions. Okay, so also the present. Now coming how you are going to diagnose a diabetic ketoacidosis. Here the blood test. Okay, so blood test also very important, and the blood test for the hyperglycemia. So there is urine test for the identifying the ketone bodies and the urine. Then ABG analysis is very important to rule out, so that is acidosis. Okay, so to confirm the acidosis. Okay, so then serum electrolyte is very important to know them, so that is electrolyte imbalance, hypocalcemia, and so hypercalcemia. So EC is also important. Okay, so these are the diagnostic evaluations and different diagnostic tests Okay, so we're going to use, okay, so diagnosing a diabetic ketoacidosis. Now commonly how we are going to manage, okay, so these conditions. The management is very important because it is a complication of, so that is diabetic mellitus, but it also it is also not treating properly, means it also causes further complications. The patient will lose his life. Okay. The first and foremost, the first step for so the diabetic ketoacidosis is okay, so the F is done for, so that is fluid management is very important through the normal saline. Okay, so administration of the normal saline to maintain the, so the fluid balance is very important. Then insulin administration is very important. So then okay, so the replacement of electrolyte also is very important. Then the monitoring vital signs, then identifying the underlying, so the cause, what is the cause, exact cause for the, so this diabetic ketoacidosis, and treating sugar cause also very important. So that is preventing further complications is very important, because prevention is better than cure. Okay, so prevention of further complication is very important. If still you are not taking proper care of the persons who are having a diabetic ketoacidosis, what happens? So it may causes for the dehydrations, so that is shock, coma, and even death. Okay, so this is regarding to the clear cut informations regarding to the diabetic ketoacidosis.